Hi, my name is Amber. I'm 30 years old, and this is my daughter Anastasia. It's my little co-star. I have postural orthostatic tachycardia syndrome, also known as POTS. So I figured I'd come on here and talk about it since there is an increase of people getting diagnosed after having COVID. It's becoming more common, and I'm going to go through symptoms, the diagnostic process, what you can do to help, and the fact that POTS can be dangerous. I passed out yesterday from it, and that's part of it. And I also bruised my ribs. I think I might have broken one. 1 second, and I'll let you see that. And I also pulled muscles in my back and the lower left of my stomach. We're talking to the people about POTS. The thing that makes mommy pass out. Yeah. Okay, so not everyone that has POTS actually passes out. Actually, only about 15% of POTS patients actually pass out. Symptoms can include, obviously, dizziness, very fast heart rate. Mine, I'm typically in the 80s resting, and I go anywhere between the 130s and the 180s whenever I stand up on bad POTS days, and then anywhere between like the 130s and 140s on, non flare-up type phases. But nausea is a symptom for me. Fatigue, definitely some brain fog. You can have tunnel vision, completely lose your sight and hearing whenever you're about to pass out. What are you making faces for? And let's see, what else? I mean, there's a whole slew of symptoms, like over 200. Just Google them. It's different for everybody. So what helps me has been increasing my salt intake, drinking a crap ton of water, like a gallon and a half a day, and compression socks. Compression socks have become my aesthetic because, they do help, because what causes POTS is the fact that it's an autonomic nervous lack of response, kind of. So normal people that don't have POTS, whenever they stand up, the blood goes to their feet, but their body contracts the vessels in their legs, which pushes the blood back up to their brain and their heart. When you have POTS, it just pulls in your feet. We don't have that mechanism that pushes the blood back up. So that's what causes either the pre-syncope or the syncope. In my case, I'm part of the 15% of people with POTS that passes out frequently, like at least once a day. You showing your foot? But so diagnostic criteria. So if you're I can't remember the ages, it's an adolescent age. On the tilt table test, you'll need to have a rise of at least 40 points within 10 minutes. If you're above 18, it's a rise of at least 30 points within 10 minutes. Mine jumped up, I believe it was 58 or 68 points whenever I did my tilt table. And I was already on flecainide and metoprolol for AFib, because that's another one of my issues. So there's not much that they can do for me treatment-wise for the POTS. So they just said, compression, salt, and water. Just hydration. Although I have noticed that when I've had to go to the hospital and get IV fluids, I always felt better afterwards. So that could be a thing. But basically, back to the diagnostic process, you'll have to see a cardiologist, and they refer you to get the tilt table test. And then they See, after I had my positive tilt table, I got moved over to a neurologist that specializes in autonomic nervous system issues, which is what POTS is. It's a form of dysautonomia. And we've been working together on like how to get me feeling better. I'm trying to get approved for at-home fluid treatments. So that's a work in progress, but I just wanted to let you know that, you know, the diagnostic process for POTS can be difficult because the way medical gaslighting is, they're going to try to say it's anxiety quite a few times. You may have to go through 4 or 5 doctors to be able to even get a tilt table test, because there is some doctors that still think that POTS is rare. They're not accepting the fact that, you know, it's common. It has been common, but now it's becoming increasingly common because it's a symptom of long COVID. And I had it before COVID, but, you know, that's one thing that people is developing from it. And how you can manage it, along with the extra salt, the water, the compression. If you start to feel faint, like you start to have presyncope symptoms, ears start ringing, your vision goes tunnely, heart starts racing, or anything like that, find a place to sit down. Because, you know, you never know if it's going to be that moment where it's just going to be presyncope or complete syncope. So you definitely don't want to hurt yourself. I actually have a mobility aid sitting over there. It's a rollator that I use for, you know, bad POTS days. And, you know, it's something that you definitely want to get checked out if you're having those symptoms. If you have like a smartwatch, Fitbit, Apple, whichever, Apple has an app called Tachymon that you can use to track it, and it tells you like how many beats your heart went up and keeps a record of it. I have Fitbit, so I use Cardiogram, and it keeps a log of when you're... What are you doing? It keeps a log of when your heart rate dramatically rises, and it lets you tag it on what you were doing, so that way you can keep a record and show your cardiologist or neurologist. So that way, you know, hopefully it can help lead to a diagnosis. Once you do get a diagnosis, there isn't much that they can do for you, you know, like I said, which sucks. And it's going to impact your daily life. Like, I used to be pretty active before I got this. I first got it in like 2018, 2019, somewhere in there. It was after me and my son almost died from severe preeclampsia and HELLP syndrome. If you'd like a story time on that, let me know. There's a lot of medical gaslighting, medical neglect, all of that good stuff. So I will do a story time on that if you guys want. If you have any more questions about POTS, feel free to ask. I've been living with it for years. Also, just recently got diagnosed with celiac disease. I am LADA, which is late onset type 1 diabetes. You know, all the things. So if you need any answers, guidance, anything on any one of those, I can help. I can do a live. If you'd like a Q&A, just let me know. And take care of yourself. If you think you have it, get some help. Get a diagnosis. There are treatment options. There's just not very many. Hope y'all have a good day. And the whole purpose of this video is to raise awareness, since the rising numbers of diagnoses since COVID. It's something people need to know about and need to know how to help themselves with.